Welcome to For Your Health Media. This is Miriam, nurse practitioner. We're going to talk about 10 New Year resolutions for 2022. Okay, for your health, to improve your health. The first one is cervical cancer screening, aka pap smear. We do that for women who are at least 21 years and up. If you're 21 years and up, they will do it, the screen one time and then every 3 years. From 30 years and up, they might do it every 3 years or every 5 years. Again, the pap smear, cervical cancer screening, is to screen for cervical cancer. Because a lot of times when you have this cancer, you may not know that you have it. So it's good to screen. So you haven't done it, go and get your screen done. The second screen we're thinking about is diabetes. For the New Year resolutions, ideas to improve your health, make sure you get screened for diabetes. Why? Because diabetes is a disease that when you have it, you may not know. So diabetes has all these complications that might affect your eyesight, amputation, you get some limbs cut off because of diabetes, kidney problem. But the sad thing is a lot of times you might not know that you have it. So it's good to see somebody, make it as one of your New Year resolution to check you for diabetes, to make sure you get screened for diabetes. Another screen to do, healthcare screen to do for come the year 2022 is for HIV screen. HIV is a sexually transmitted disease, or you get it through blood and things like that, and that affects the whole immune system. But most of the time you will not know you have it, so it's good to get screened. Here in the United States, the CDC has given a recommendation that from the age of 13 to 64, you want to be screened for HIV every year. So that is why sometimes when you go to see your doctor, they might be, telling you about, let's screen you have you done your screening for HIV this year? Another screening that is very important is chlamydia. I'm sure you've heard that name. Chlamydia is a sexually transmitted disease. Chlamydia is very common here in the United States, to the extent where they have recommended now that people under 24 years of age who are sexually active should get screened for chlamydia. And a lot of times chlamydia has a friend, gonorrhea, so they always come together. So it's very important to get screened for that. And then if you are from 25 years and up and you are having a risky behaviors or whatever, you also need to request for that test. Why? Because chlamydia can cause infertility. So a lot of times people may not know that they have it. They say in 70% of women, they might not have symptoms. And then in 50% of men, they might not have symptoms. But the only time they might start knowing is when they're trying to have a child. All of a sudden, they're having other issues. And then that is when they might discover that. So that is why they have recommended now that, 24 years and under, or even every time that someone comes to see us in primary care, we should try to see if we can screen, for chlamydia. Another screening that is very important for you is your eye exam. You have to do your eye exam once per year, at least, because that is how they detect diseases. There is one disease that is so notorious that could even cause blindness. They call it glaucoma. In fact, in the media here in the United States, there was one popular actress by the name of Christy Brinkley was talking on her social media last 2 weeks or so about how glaucoma, she went to see her eye doctor just for a routine eye check. And then they discovered that the doctor told her that she has glaucoma. So glaucoma, if you get the bad kind, it can cause blindness immediately. If you get a slow one, which is also known as open angle glaucoma, you get medication for life to, decrease the pressure of your eye, but you will not know that you have it unless you get a full eye exam. So it's very important to get a yearly full eye exam, because a lot of times these eye diseases, majority of them are notorious for not having symptoms at all. So you would think you are aware, but you need to get checked. The other New Year resolution for your healthcare screening that I'm thinking about is cholesterol screen. We have two types of cholesterol, the good one and the bad one, of which the body produces. But for whatever reason, we indulge in foods that increase the bad one. We eat fried foods, junk food, with smoking cigarettes, alcohol, inactivity. So it increases the bad cholesterol, and that eventually will end up, increasing our risk of heart attack and stroke. So when that happens, a lot of times we don't know we have high cholesterol because it doesn't have symptoms. So when you go in there and they screen you, they'll find out, oh, wait a minute, let's improve the diet, or let's keep doing what we're doing. Because then cholesterol does not, when you have high cholesterol, it does not show any symptoms. The other screening that you should think about as far as your 2022 New Year resolution is breast cancer screening. Usually they start in women around 45 years and up. But, if, depending on your condition, if there's a family, history, then the doctor, you and your doctor might discuss it, and you might start it sooner than that. So you will go in there, and the doctor, they will do what is known as a clinical breast exam, and then will prescribe a mammogram. They might either say, this is just a screening mammogram, or this is a diagnostic. Meaning, if it's a diagnostic, maybe they found a lump or something there that they want to be, for them to really investigate. But again, if you don't go, to get checked, you will not know. So it's very important to get screened for breast cancer. The other thing that I'm thinking as far as your 2022 New Year resolution, health screening to improve your health is blood pressure check. Blood pressure is associated with hypertension. Hypertension is known as a silent killer. So when your blood pressure is not checked, you will not know. Because people will say, well, I'm doing well, I don't have any problems. Well, but you don't know. If the blood pressure is not checked, you will not know. So it's very important to get it checked so that you don't become a victim to the silent killer. The ninth reason, as far as your 2022 New Year resolution to improve your health, is dental exam. You need to see a dentist once a year, even if you're not having any toothache or any problems. Because, again, that's how they discover problems. When you go there, they take your dental x-ray, chances are they will discover some problems there. So it's good to do that. And also, you will even be getting your dental cleaning. Some dentists will recommend the dental cleaning every 6 months, or if your case is different, you and your dentist can decide how often you should go in for your dental cleaning. The last screening that you should also include in your 2022 New Year resolution to improve your health is colon cancer screening, also known as colorectal cancer screening. And once you talk about colon cancer screening, people start thinking, oh, they are going to put a tube down my rectum. That is the test known as colonoscopy. Colonoscopy, yes, you get preparation, cleanse your colon, and then you go in there and they put that tube to check for colon cancer. If they find any polyps or anything there, they might say, oh, come back in 3 years or come back in 5 years' time. If they don't find anything, they will say, okay, come back in 10 years' time. But that's just one of the tests. There's another test that they are now doing, they call it CT colonoscopy. The CT colonoscopy, aka, or another name for that, is virtual colonoscopy. So they don't really have to put any tube anywhere, but it can still screen you for colon cancer. The other simple and least expensive, very cheap one I would do too, is that at the office when you come, we'll just give you a packet. And that packet will have the instructions and everything in there. We'll have the instructions and everything in there for you to do that test. But we always give you instructions saying make sure for 3 days, do not eat any red meat, do not eat red beets, do not eat anything red. The reason being, some of those food things could make you have a positive stool screen test. So when they give you the envelope or the packet and the instruction, make sure that you are following the instructions so that you don't end up with a false positive result. Most of the time what we do about the stool is that you have to get 3 consecutive, stool on different times, that are negative. Then that's when we said, okay, you are done for this year. And that one is done yearly, every year. But of course, if it's found that during the 3 times that you have followed instructions, done it the way you need to do it, and still we found something wrong with that, then you really need to, to go ahead and refer you to a specialist, to go and do more tests to find out what's going on. So these are the great ideas. These are some of the great ideas to take care of yourself. Screenings. And I forgot, screening, yes, we're screening to make sure we find the disease that you don't have symptoms yet. So it's very important to do these screenings. There are several screenings, but these 10 are also very important. So make sure you do them so that you live to enable you to live a better life. So remember, your health is the most important asset that you have. Take good care of it. Do some of these screenings if you qualify or you are eligible. Do them. Share the video with people that you love. Subscribe so you get great content like this to do what help you take care of yourself. Remember, it's all about your health.